Hello, everyone. So today, I want to talk about something really important. So right now, many Americans are discovering that their health insurance premiums may skyrocket in 2026 because of the enhanced federal subsidies that have helped lower costs. These are set to expire. So according to a Reuters report, some plans could even double in price next year. And there are certain states that are already warning that private plan premiums could rise dramatically when the subsidies end. So it's a time where people are trying to figure out what to do with their health plan. And many people already know that they're paying more out of pocket with deductibles, co-pays, surprise bills, and still not getting the health care they desire. And that's why people are asking, is there a better way to take care of my health? So I'm Dr. Lola Shaye. I'm a board certified family and lifestyle medicine physician with special training in menopause care, and I'm the founder of InTouch Primary Care. And at InTouch, we've created a whole new way of providing primary care based on membership and wellness instead of worry, hidden cost, or inflexibility that often comes with insurance. What we do is we help busy people stop waiting for a crisis and start building real health through personalized proactive care. So as we enter open enrollment season, I know many people are asking, what shall I do about my healthcare for next year? Maybe premiums are going up. Maybe people are losing their subsidies. Maybe you're thinking, is it even worth keeping a plan? So today I want to help kind of talk about that decision, not from a standpoint, I'm not an insurance broker, but as a primary care doctor who has seen firsthand what happens when health gets pushed aside. And the situation we're in now is not ideal at all. Unfortunately, healthcare has gotten worse over time, but it is possible to still, there are solutions that I wanted to bring to your attention. And if you're in Texas and you want to explore personalized care without insurance hassles, feel free to schedule a free 15-minute consultation with us at InTouch Primary Care. We'll talk about your goals, your options, and how membership-based care might fit into your health plan in 2026. Okay, so I've been practicing for over 18 years now, and I've learned something important. When we catch things early and address them early, they're almost always easier. They're definitely less expensive to handle. But when we delay care, the cost actually doesn't go away. We just end up paying later with interest in form of pain, stress, and financial strain. And I've seen patients who have waited for years to get a checkup because they don't have insurance or they just are too busy. And then by the time they come back and check, the mild high blood pressure has become kidney disease. The prediabetes has become complicated diabetes or heart failure. So if you don't pay attention to healthcare now, the problem is it doesn't wait. You just end up paying more later. And not just in dollars, it affects energy, it affects time, the ability for people to be for you to be there for the people you love. So some form of healthcare is absolutely necessary. And so I want to kind of go through how you may want to think about it when you're making your decision. So before you cancel, before you renew automatically, before you decide about going for what coverage, I would recommend take a step back and you can ask this 5 questions. The first one will be, what's my current health status? And, be honest with yourself. Do you know what's happening with your body right now? Have you had your labs checked? Have you had your preventative tests? Do you have ongoing conditions like high blood pressure, diabetes, high cholesterol? Do you have hormonal changes that need to be monitored? Knowing your baseline will help you choose the care that actually supports your needs, right? Because there's really no point getting a health plan that won't actually help you get healthier, right? Even if it looks like it's cheaper on paper, what is the point of paying for something if you're never going to use it when it's not going to help you get healthier, right? So consider your current health status. Number two, Consider your health goal for 2026. Where do you want your health to be in 2026, December 31st, 2026? Do you want to have more energy? Do you want to have come off of medication? Do you want to have lowered your weight? Do you want to finally address that symptom that you've been delaying, getting checked out for some time now? So setting a clear goal helps you align your decisions with your values because your health directly affects every other aspect of your life, right? So knowing that can be helpful. The third thing would be understanding your healthcare needs. So now you have an idea of, what your current healthcare status is. You're honest with yourself. It could be unknown, right? And now you've decided what your goal should be. Maybe now you want to know. Okay. So understanding what that is going to entail. Do you just need lab work? Do you need tests? Are you not sure exactly what you're going to need? So that means you need to know how have a predictable type of payment structure, because if you don't know exactly what you need, you don't want any surprises, right? When you plan ahead, you can choose the type of care that covers what you actually need instead of just paying for services that you are rarely going to use. So here is one way to think about it. Like, if nothing changes with your healthcare today, where will your health be in 3 years, in a year, in 5 years? Would you be able to accomplish the things that you've set out to in all the other aspects of your life? Would you have the energy to enjoy your family, your work, your purpose? So it's important that we're all intentional about our health, right? And so understanding our healthcare needs is not optional. It's really important. It's not something that we should delay. And if you're finding this helpful so far, please take a second to just share this with somebody that might need it. Subscribe to this channel. It really does make more people make informed decisions about their health and discover options for care. Okay, so now let's get to it. The other thing that I would recommend, a question is, or a suggestion is, look beyond the premium. So many people focus on the monthly premium. They don't know or understand what deductible, co-pays, co-insurance mean. And the issue with that is those costs can really quickly add up. So even with insurance, a lot of times these costs create barriers to care. And that's one reason why people are exploring options like ours, direct primary care, because it's a flat fee. You get same next business day visits at InTouch Primary Care, same doctor, transparent pricing, personalized care, right? So regardless of what you decide, it's worth comparing what you actually spend per year versus what you're actually getting. Because there are a lot of people that are very, very intentional about getting health insurance, but they never use it because they're scared to use it. And what they're not getting any healthier. They just have that, and all that money is gone, but they're not healthier. So, researchers at Johns Hopkins University have noted that even with insurance, many people are paying more out of pocket through rising deductibles, co-pays, and surprise bills. So it's not just about having a health plan. Many have health plans, but it's about having a health plan that will help you get healthier. Saving money by getting a cheaper plan only matters if the plan truly supports your health. Otherwise, you're really not saving, you're just postponing the cost. Okay. The fifth thing is explore ways to save smarter. So, for instance, if you qualify for a health savings account or a flexible savings account, you can use pre-tax dollars for medical expenses, including primary care memberships like ours. You can use it for labs, for prescriptions. You can save hundreds or even thousands of dollars a year by exploring these options. Also, starting in 2026, patients without the credits for the Affordable Care Act can also now pair a low-cost catastrophic plan with a health savings plan and use those pre-tax dollars to pay for membership care, for instance, and get kind of like a good deal there. So that could work for some people. So again, if you don't have the tax credits for the Affordable Care Act plans, you can now pair that with a low-cost catastrophic plan, and we'll put the link for more information about that in this video. Okay. So if you're in Texas and you want to explore, options like I've talked about the membership option, you can schedule a free 15-minute consultation with us at InTouch Primary Care. We'll talk about your goals, we'll talk about the options, and we'll see if this may be a good fit for you for 2026. So imagine your healthcare actually worked for you, right? So think about these things we talked about. We've talked about, understanding your current health status, right? So that you know what your health goal should be for next year. And understanding your healthcare needs, and then using that information to look, choose a plan, looking beyond the premium and exploring ways that you can save in order to choose the right plan, right? So whether you stay with the traditional health insurance plan or you choose a membership model, just remember this: don't neglect your health. Be intentional, because it is possible to transform your health by the end of 2026, but it starts with making informed decisions today. And I hope that helps. Remember to share, like, subscribe. Thank you.